Thank you, Mr. Chairman. Thank you for being here. I know you've been at a lot of hearings. We appreciate your round-the-clock work. And as no surprise to anyone, the virus is moving fast. Nevada's just reported its first case of the virus today. I've been in close contact with our state officials, our governor's office, and I want to emphasize, really stress the importance, just like the other senators have here, how important it is to keep those clear lines of communication open with really good data that they can respond. There are boots on the ground. But what I'd like to address is federal assistance for the impacted individuals. If larger quarantine measures are needed and medically justified, what plans are in place to provide relief to those Americans who may miss work due to government-imposed quarantine, but not necessarily to their illness? Many folks live paycheck to paycheck. The loss of a few days' work is a major hardship, let alone staying home for a few weeks. This could lead to people losing their homes, not being able to afford food or other essentials. And so if we have disaster-like situations on the ground, what can FEMA do to help alleviate this in the short term? What do you need from us to help with that?
So FEMA has been in place with ASPR at HHS for almost a month now, and assisting them, bringing the expertise FEMA brings to disaster response to this effort, still with ASPR as the lead federal agency, of course. People naturally look to Stafford Act, and this is a disaster of sorts, but the response mechanisms are not the same. It is not currently anticipated that you would see a Stafford Act declaration. The intensity of the problem will be different in Nevada than it will be in Virginia, for instance. And so there is the base fund that where governors can make requests when elements of their systems are overwhelmed for funding. There is a $5 million cap that is waivable for that, and this is not the disaster relief fund, the $34 billion disaster. This is a base fund that has about $640 million or so in it.
And would they be able to use this? We know that around the country, some places are reporting school closures. We could anticipate maybe closures of senior centers. So we have many kids across this country, many in my state, kids on free or reduced lunch, free breakfast. We have senior centers where those seniors are reliant on those meals every day. How do we ramp up and give the ability, if there's a school closure, a senior center closure, to use Meals on Wheels or give brown bags to these kids and their families? Can you speak to that?
Yeah, I believe, but it's belief. I believe Secretary Azar has some authority to expand aid, welfare programs under these circumstances, but FEMA nor DHS do not have dollars available that would legally fit the description of the relief you're describing, Senator. So that's something that I believe is being covered and addressed in the supplemental. That is the appropriate vehicle. And I would just note more generally that Dr. Cadlick referred to the planning efforts that have gone before this all arose, and we operate off the PANCAP 2018 plan. And in that plan, it was envisioned that the financial vehicle to deal with an outbreak of this nature was via supplemental. So we are sticking with that plan, and as was said 6 weeks ago, if we need dollars, we'll come to the Congress. We're here now, of course, and that discussion's going on, and it is including the kind of things you're describing.
So our governors would be able to request this and funnel it to communities that need it, is what you're saying?
No, I think we're mixing two things. If the supplemental includes monies to address the types of shortcomings, financial shortcomings you're describing, then the answer would be yes. There's nothing currently legally in place that FEMA has available that would fulfill the needs you're describing. So I want to make sure that...
So we may have to look to that in the future and see
yes,
what we have to do to take care of those vulnerable populations. The next thing I'd like to ask you is about immigrants that are seeking care. You know, Nevada's diversity is its strength, with about 1 in 5 Nevadans born outside the United States. Many more excuse me, living in households with immigrants, some of whom are undocumented. As we work to contain the coronavirus, we have to ensure that there's timely access to medical care for everyone who needs it, regardless of their status. This is a public health and safety issue. Anything less puts all of our communities at risk. So, Mr. Cuccinelli, no one should be afraid to seek care as the coronavirus spreads, placing our communities at risk. Will the department refrain from apprehending individuals based solely on their immigration status while they're in the process of seeking care?
So much like the CDC-CBP relationship pre-exists this virus, it is something that has stood before. ICE also has an already in-place policy, their sensitive locations policy. They do not do enforcement in healthcare facilities absent single case exigent circumstances. So there is no reason anyone should expect that law enforcement
Would they
to take
refrain from
place.
potential intimidation factors, such as placing vans outside of community centers or health centers where people may go to seek these tests?
That would be consistent with the policy, Senator.
Thank you. I yield back.